Welcome back, everybody, to the deep dive. Ready for another deep dive? Today, we're tackling whooping cough.
Yeah, we're going to delve into some fascinating stuff about whooping cough today.
And it's also known as the 100-day cough. So
Right.
that should give you an idea of what we're getting into.
Yes, it is definitely more than just a cough, as we'll find out.
Exactly. Now, to give you a little background on where we're getting all this information from, we've got some great sources today. Microbe-wiki.com, Wikipedia,
Oh, yeah.
and Microbe Canvas.
Excellent resources.
By the end of this deep dive, you're going to be well-versed in whooping cough. We're going beyond those common misconceptions and really diving deep into the different stages. You know how it starts so sneaky?
Yeah.
And what actually causes it? And most importantly, how to prevent it. Because this is serious stuff, folks.
It is. It really is. It can be a lot more serious than people think.
Okay, so let's jump right in. Let's start with those initial symptoms. It's like a wolf in sheep's clothing, right?
Mm-hmm.
Looks like a common cold at first. So how can people tell the difference?
Well, yeah, initially you might think, oh, it's just a cold. You might have a runny nose, you're sneezing, you have like a mild cough, maybe a little bit of a fever.
Right. Sounds familiar.
Yeah. But the key difference is what happens next. That cough, it doesn't go away. It gets worse. It turns into these severe, uncontrollable coughing fits, and they can go on for weeks. And sometimes when the person tries to take a breath after a coughing fit, you hear this whoop sound.
The whoop.
Yeah, I've heard recordings of that whoop sound.
It's pretty disturbing.
It is. It's kind of haunting, actually. What's going on in the body to cause that?
Well, it all comes down to this bacteria, Bordetella pertussis.
Mm-hmm.
And this little bugger gets into your respiratory system and it latches onto the cilia. Those are like the little hair-like structures that help clear mucus.
And these bacteria just cling on, they multiply, they start releasing toxins that actually damage the cilia. And that makes it really hard for your body to get rid of all that mucus building up. And that whooping sound, that's the sound of you struggling to breathe after one of those coughing fits.
So it's not just the cough itself, it's the damage that these bacteria are doing to your airways.
Yeah.
And you mentioned toxins. Tell me more about those. What are we talking about here?
So there are two main players here. Tracheal cytotoxin, we call it TCT for short. And then there's pertussis toxin.
Okay.
Now, TCT, that's the one that really messes with the cilia. It damages them and makes that cough so much worse. Pertussis toxin, on the other hand, it's a little more complicated. It can actually cause a condition called lymphocytosis.
Lymphocytosis. Say that 10 times fast.
Yeah, that means you have way too many white blood cells. And this can lead to pulmonary hypertension, which is high blood pressure in the arteries in your lungs.
Oh, wow. Okay, so it's like a domino effect. The bacteria, they release the toxin. That increases your white blood cell count.
Yeah.
And then that leads to problems with blood flow to your lungs. And I imagine that's especially dangerous for infants.
You are absolutely correct. Infants are the most vulnerable because their airways are so small and their immune systems are still developing. And in some cases, that pulmonary hypertension can be fatal.
Okay. This is already painting a pretty scary picture. It's definitely not just a cough, folks. So how does whooping cough actually progress? You mentioned stages earlier, right?
Yes, there are 3 distinct stages of whooping cough. The first one, it's called the catarrhal stage.
Partial stage.
That's where it really does look like a regular cold. And it typically lasts about 1 to 2 weeks. And then the cough intensifies. And that signals the start of the paroxysmal stage.
Paroxysmal.
Paroxysmal, yeah. That's when those violent coughing fits really kick in. And that can go on for 2 to 8 weeks.
Oh, wow.
And then finally, there's the convalescent stage where things start to calm down. The coughing fits become less frequent. Okay. But even then, you're not out of the woods. You can still have coughing spells for months after that.
Wow, so we're talking potentially 3 months or more of dealing with this.
It can be a long haul.
No wonder it's called the 100-day cough. And just to be clear, not everyone has that signature whoop, right?
That's right. Only about half of the cases actually have that sound.
Oh.
And that's an important thing for people to keep in mind because they might think, oh, it's not whooping cough because I don't hear the whoop.
Right.
But it could still be.
So even if you don't have the whoop, if you have this persistent, intense cough that's just not letting up, that's a red flag, right?
Absolutely. It's really important to see a doctor if you suspect whooping cough, especially if you've been around infants or young children.
Right.
Because they're the ones at most risk of developing serious complications.
Okay. That's really important to remember. Now, I'm curious, what kind of complications are we talking about here? I know you mentioned the pulmonary hypertension in infants, but are there other things that people should be aware of?
Oh, unfortunately, yes. Those coughing fits are so violent, they can cause all sorts of problems like vomiting, broken ribs even, hernias,
Oh, man.
and even subconjunctival hemorrhage, which is where the little blood vessels in your eyes burst.
Oh, wow.
Not a pretty sight.
No, that doesn't sound pleasant at all. It really emphasizes how serious this can be.
Yeah.
Okay, so we've talked about the symptoms, how it progresses. Now let's move on to diagnosis. How do doctors actually figure out if someone has whooping cough?
Well, it can be tricky, actually, especially in the early stages, when it just seems like a cold.
Right.
Doctors have to look at a lot of different factors, the patient's symptoms, their medical history,
Right.
and then, of course, there are lab tests.
So it's like a detective piecing together clues
Exactly.
to crack the case.
Yeah.
What are some of those clues that doctors look for?
Well, one of the biggest red flags is those coughing fits, especially if they're so bad that the person vomits afterwards. That's pretty characteristic of whooping cough. And of course, if they hear that classic whooping sound,
Right.
that's another giveaway. But as we said, not everyone gets that. So you can't rely on that alone.
You mentioned lab tests. What kind of tests are used to actually confirm a whooping cough diagnosis?
Okay, so there are a few different ways to test for it. One way is to take a sample from the back of the nose and throat, like they swab the area,
Okay.
and then they try to grow the bacteria in a lab. It's called culturing.
Oh, so it's like planting a seed and seeing if it grows.
Exactly.
But in this case, you're hoping it doesn't grow.
Right, exactly. But, culturing, it can take a while to get the results. So there's another method called polymerase chain reaction, PCR for short.
PCR. That sounds familiar.
Yep.
Wasn't that used a lot during COVID?
Yeah, it was all over the place. And it's a really useful test. It's very sensitive. It can detect even tiny amounts of the bacteria's DNA. And it's a lot faster than culturing.
Okay, so that's a good option. Are there any other tests?
Yeah, there's another one called direct fluorescent antibody test, DFA. And this one, they use these special antibodies that bind to the bacteria. And if the bacteria are there, the antibodies will light up under a microscope.
Oh, wow, that's cool.
Yeah, it's pretty neat.
So it's like using a black light to reveal hidden evidence.
Exactly. And then there's another test called serology. And that one looks for antibodies against the bacteria in the patient's blood.
Okay.
So this can be helpful, if the infection has been going on for a while, because it can detect past exposure, even if the bacteria aren't still hanging out in the respiratory tract.
So even if the bacteria have moved on, the fingerprints are still there in the blood.
Exactly. But here's the thing. All of these tests, they work best in the early stages of the illness. The bacteria are usually only detectable for the first few weeks after symptoms start. After that, the tests become less reliable.
So early diagnosis is critical, both for the patient and for preventing the spread of the infection. Which brings us to prevention. And I know vaccination is key here. Can you walk us through how the whooping cough vaccine works?
Sure. The pertussis vaccine, it's usually given as part of the DTaP vaccine. And what it does is it exposes your body to inactivated forms of the pertussis toxin and other parts of the bacteria.
Okay.
And this triggers your immune system to produce antibodies,
Right.
which are like little soldiers that fight off infection. So if you ever encounter the real deal, the Bordetella pertussis bacteria, your body is ready to fight back.
It's like giving your immune system a training manual.
Exactly.
So it knows exactly what to do when the enemy attacks.
Right.
But I've heard that even with vaccination, whooping cough is still a problem. Why is that?
Well, it's a great question, and it's true. It's definitely still a concern. You see, the immunity that you get from the vaccine, it does wane over time. It's not a one-and-done sort of thing.
Right.
Which is why those booster shots are so important, especially for older children and adults.
So it's not a set-it-and-forget-it kind of vaccine?
Nope.
You need those boosters to keep your defenses strong? Are there other reasons why whooping cough is still around even in vaccinated populations?
Well, bacteria, they're pretty clever. And Bordetella pertussis, it can mutate and change over time.
Right.
And some of these mutations, they allow it to kind of sneak past the protection that the vaccine offers.
So that's like a constant arms race between the vaccines and the bacteria.
You got it. And scientists are, they're always researching and developing new vaccines that can better target those mutated strains.
Right.
It's definitely a challenge keeping up with them.
So this really underscores the importance of staying up to date on vaccinations, not just for ourselves, but for the community as a whole.
Oh, absolutely.
We're all in this together.
Herd immunity is so important. When enough people are vaccinated, it creates this protective barrier that makes it much harder for the disease to spread, especially to those who are most vulnerable, like infants.
And I know there's a big push to vaccinate pregnant women
Yes.
to protect those newborns who are too young to be vaccinated themselves.
Yeah.
Why is that so important?
Yeah, so it's about giving those little ones a temporary shield, you know?
Okay.
When a pregnant woman gets the vaccine, she develops antibodies. And those antibodies, they pass through the placenta to the baby.
Oh, wow.
And those antibodies give the baby some protection for those first few months of life before they can start their own vaccination series.
It's like a borrowed suit of armor.
Yeah, it is. Exactly.
Until their own immune systems are strong enough to fight back on their own. What happens if, despite our best efforts with vaccinations, someone does get whooping cough? What's the treatment?
Well, antibiotics are a really important part of treatment, both for treating the infection itself, but also for preventing it from spreading to others.
So even if you're vaccinated and you get whooping cough, you still need antibiotics.
Yes, you do. The antibiotics, they can help shorten the illness and make the symptoms less severe,
Okay.
even in vaccinated individuals. And they also reduce how long you're contagious for, which, is important for protecting others.
Right. So it's kind of a win-win. You're helping yourself recover faster, and you're helping to stop the spread of the infection to other people. What are the usual antibiotics that are used for whooping cough?
So usually macrolides are the go-to. Things like erythromycin, azithromycin, clarithromycin.
Okay.
They work really well against Bordetella pertussis, and they're usually well tolerated. Now, sometimes, like with infants who might have an adverse reaction to macrolides, doctors might prescribe trimethoprim methoxazole.
Okay, so there are options
Yeah.
depending on individual needs.
Yeah.
But are antibiotics always effective?
That's a really good question. And the answer is they work best when they're started early on in the illness, ideally within the first 3 weeks of symptoms starting. If you start them later, they might not have as much of an impact, but they can still help reduce contagiousness even in the later stages.
So again, early detection, early treatment, that's really important.
Absolutely. The sooner the better.
Okay, and one other thing I was curious about.
Yeah.
Even with the antibiotics, they don't magically erase the effects of the bacteria, right?
Right.
I mean, that damage to the cilia that we talked about.
Exactly. That takes time to heal. And the coughing can linger even after the infection's gone.
So it's not an instant fix. Patients and supportive care are still really important during recovery.
Very important. Now, we've been talking a lot about the effects on individuals, but it's also important to remember that this is a global issue.
That's a good point.
Whooping cough affects people all over the world.
We can't forget about the bigger picture. So tell me, what can you tell us about the global impact of whooping cough?
Well, despite all our efforts with vaccination, it's still a significant health challenge worldwide. There are millions of cases every year, and sadly, thousands of people die from it every year, mostly in developing countries.
Wow, that's heartbreaking. It's a preventable disease.
Yeah.
Why is whooping cough still such a problem, especially in developing countries?
Well, there are a lot of factors that contribute to that. Limited access to health care, lower vaccination rates, and sometimes just the logistics of getting the vaccines to where they need to be and keeping them properly refrigerated. It's a challenge.
So it's a complex problem.
It is.
What can be done to address these challenges?
It's going to take a multi-pronged approach. Strengthening healthcare systems, improving access to vaccines, and raising awareness about the importance of vaccination.
So it's a big task, but a very important one.
Very important.
It's a good reminder that we're all interconnected.
We are.
And we have a shared responsibility to protect those vulnerable populations around the world. Okay, this has been a really insightful exploration of whooping cough. I feel like we've covered so much. From those sneaky, cold-like beginnings to the potential for serious complications, the importance of vaccination and early treatment, and the global challenges that we still face. Before we wrap things up, let's just take a moment to recap some of those key takeaways to make sure everyone listening feels empowered and well-informed. All right, so we're back. We've been talking all about whooping cough. It's not as simple as it sounds, is it?
No, not at all.
Lots of layers.
Yeah.
So before we go, let's just take a minute to recap. What are the most important things you want listeners to remember?
Okay, well, first of all, remember that whooping cough, it's a serious bacterial infection.
Okay.
It's not just a cough. You get these intense coughing fits that can drag on for months. And remember, you don't always get that whoop sound.
Right, not everyone gets the whoop.
So don't be fooled by that. It's the severity and how long that cough sticks around that should be your warning sign.
Exactly. And you mentioned earlier how infants are especially vulnerable.
Oh, yeah, absolutely. Their little airways and their immune systems are still developing, so they're at much higher risk for complications.
Yeah.
Which is why vaccination is so important.
Right. And even though the vaccine is our best defense, It's not a one-time thing. We need those boosters as we get older.
Exactly. Boosters are key. The bacteria, they're always changing.
Right.
They mutate, they
Such
adapt.
little things.
Yeah, they are. So scientists, they're always working to keep up and develop better vaccines that can target these new strains.
It's a constant battle, and that's where research and, global cooperation really come in.
Right. We've got to work together on this. Make sure everyone has access to the protection they need, no matter where they live in the world.
Absolutely. Global health, it's everyone's responsibility.
It really is. We can't let our guard down when it comes to preventable diseases like this.
This has been such an eye-opening deep dive into the world of whooping cough.
It has.
I hope everyone listening feels more informed and empowered. Knowledge is power, especially when it comes to things like infectious diseases. So if anyone wants to learn more, I encourage you to check out the sources we mentioned, microbe-wiki.com, Wikipedia, and Microbe-Canvas. Those are all great places to start.
Yes, excellent resources. And, don't hesitate to reach out to your healthcare provider. They're always the best source for personalized advice.
Always a good idea to talk to your doctor. Well, that's all the time we have for today. Thanks for joining us for the deep dive. And until next time, stay curious.